Hello, and welcome to this month's Simon Says Expert Series. I'm Dana Cattani, a former Kelley School of Business lecturer and a 12-year cancer survivor. As a panel, we're excited to talk today about mental health and cancer. We'll cover topics about receiving the diagnosis, survivorship and resources for mental health, and advocacy as a kind of therapy. Joining us today is Susan Gubar, a distinguished emerita professor of English at Indiana University and a 16-year cancer survivor, and Terry Whitt Bailey, President and CEO of Cancer Support Community Indiana. Thank you both for joining me today. We'll hear first from Susan, then Terry, and then me. Then we'll have time for some questions. Susan?
Thanks for inviting me. In my opinion, a cancer diagnosis poses a mental health threat, and it should be treated as such. Many patients can recall where they were when they received their diagnosis and who pronounced it, but often they cannot remember any of the specifics, the staging or the prognosis, or even the next steps that they must take in order to begin treatment. Certainly that was the case for me. I was lying in Bloomington Hospital's ER when a hospitalist told me I had advanced ovarian cancer and should immediately go to the Simon Cancer Center. The whole experience is a blur, perhaps because I took the diagnosis as a death sentence. Even after a debulking operation, when I later met with my wonderful oncologist, Dr. Daniela Mate, I could not fully comprehend the words she addressed to me, maybe because she confirmed the fact that I only had 3 to 5 years to live. That was in 2008, and she and I are both delighted that we were completely wrong. But my experience underscores the fact that a cancer diagnosis often operates like a trauma. Patients are shocked, they are choked by fright, deafened by dread, uprooted from ordinary life. They sense instantaneously that, to rephrase Susan Sontag's words, they have been expelled from the kingdom of health. They have landed in the dungeon of disease. It does not help matters that most cancer treatments are themselves also traumatic. Consider the terror instilled by surgical interventions like excisions, ablations, and ectomies of just about any organ, or the isolation chambers of radiation with their ghastly masks and molds and sci-fi machinery, or the panic generated by chemotherapy drugs coursing through the bloodstream to deliver their gruesome side effects. Slash, burn, and poison, the warfare tactics described by Dr. Susan Love years ago, continue to be trained on cancer patients today. Consider then how many of the symptoms of post-traumatic stress disorder infiltrate the lives of cancer patients. Like people suffering from PTSD, cancer patients often feel overwhelmed by an intensely negative emotions of fear, anger, guilt, or shame. Such emotions can lead to thoughts of self-harm or to hypervigilance and depression. Distressing physical sensations, aches and pains punctuate our lives. Many of us experience insomnia or nightmares. The memory problems of PTSD escalate with chemo brain. More than a decade after diagnosis, I still deal with chemo feed, otherwise known as neuropathy, and with having to cope with an ileostomy that requires scrupulous attention 24/7. The simple act of eating can become a major problem, not only for those whose surgeries affect their digestive system. Then there is the abrupt outbreak of scanxiety, anxiety before a test, and fearfulness about recurrence. Predictably, social withdrawal and isolation can characterize the lives of PTSD and cancer patients. All of this, of course, affects caregivers. No wonder the American Cancer Society warns against CRPTS, cancer-related post-traumatic stress. Yet it is while suffering from the trauma of diagnosis that cancer patients must assume the huge burden of getting their care. Patients are responsible for setting up consultations, dates and hours for radiation or chemotherapy appointments, travel logistics that will get them scans and tests or second opinions. Often the difficult task of finding an appropriate clinical trial falls on the shoulders of patients. Scheduling these appointments can become a major headache, especially if one is physically debilitated from medical regimes. Negotiating with insurance and fight for financial coverage intensifies the migraine. Quite a few cancer patients face financial crises and even, unfortunately, bankruptcy. Now factor in the disparity in value given to the patients as opposed to the medical provider's time. As a patient, I want to keep my time in the hospital to a minimum. And of course, there's a huge pressure on medical professionals to do just that. Doctors and technicians are allotted only so many minutes for a checkup or a procedure. But invariably, I am kept waiting far too long. And when I see a medical professional, I'm given far fewer minutes than I need to get my issues properly addressed. The safeguarded time of medical professionals is considered precious, whereas the squandered time of patients is generally disregarded. It's a source of astonishment to me that the members of my support group managed to soldier on. When I think of those less advantaged, economically imperiled, limited in their education, physically handicapped, I can't comprehend how they do. There is a solution to this heart-rending problem. It would involve treating the cancer diagnosis as a potentially traumatic event. It would mean that medical health professionals would be on hand at every post-diagnosis moment with aids from the toolbox of their profession. Talk therapy, group therapy, cancer-specific support groups, nutritional and financial guidance, physical and occupational, sexual and sleep counselors, art and music and writing instructors, dry needling and acupuncture, exercise and yoga programs, Reiki and massage, research nurse navigators, you name it. We all know, however, that such an approach would undoubtedly help. We all know that such an approach would undoubtedly help many cancer patients, but it flies in the face of the cost-cutting procedures of the medical and insurance businesses. From my personal neck of the woods, there is another solution that depends entirely on research breakthroughs in the future. If cancer treatment could be made less horrific, it would seem less frightful. In this context, the diagnosis of cancer might register the way a diagnosis of diabetes or COPD does, a dangerous condition with which one can live for some time and live with a curtailed but not shattered life. I say this because I was astonished by the contrast between my life with standard treatment and my life with a targeted therapy. I underwent standard cancer treatment from 2008 to 2012. It functioned in precisely the dramatic manner I have just described. But in 2012, Dr. Mattei encouraged me to enroll in a phase 1 clinical trial with an experimental drug. 4 pills a day of a PARP inhibitor were much easier to take than the earlier interventions. My retirement from teaching was a done deal. However, I purchased a silver wig, which you can see today, resumed cooking and laundry routines, and began writing about living with cancer for a column on the New York Times. It was a normalized, if not normal, existence. After 9 years in the clinical trial in 2021, and with a great deal of trepidation, I heeded the advice of Dr. Mattei, withdrew from the trial, and went on a drug holiday. No one could tell me if discontinuing the medicine would lead to the cancer returning, but sustained use of the pills has the potential to cause leukemia. Needless to say, the threat of recurrence is always there, still lurking and menacing. I still have my port and regular blood tests, but I did begin writing about subjects other than cancer, which I relished, while I relished what has become my cancer staycation. At 80 years of age, I view my 16 years of survivorship as a miracle. I meditate on all the events I have witnessed with wonder and also gratitude for the researchers, physicians, nurses, and technicians who gave me a second life. Because I want that miracle to morph into an everyday happenstance for cancer patients in the future, I urge patients and caregivers to challenge federal budget cuts to cancer research. I suspect the advocacy of many patients is motivated by the same dream of a time when cancer won't be so thoroughly devastating. Thank you.
I too would like to thank Dana and the folks at IU for the opportunity to share with you today. My experience is on the other side of the cancer bed as a caregiver. And my story actually started in 2016 when my husband, of almost 30 years by that time, had 2 strokes in the year 2016 and was left without the ability to use his left side. So he was in a hospital bed in our home with caregivers 24/7 so that I could continue to work. In 2021, by 2021, after we'd done quite a few things and still lived our lives, in fact, we called it our new normal. But in 2021, he was starting to get tired, and Thanksgiving weekend, he didn't eat Thanksgiving meal. He slept through the football games, which was not like him, and was complaining of pain on his left side, on his neck. So we went to the emergency room, and as I continued to sit, I would always sit on his left side. The doctor came into the ED and said, "Ma'am, would you come over to the right side of his body?" And there was a lump, a nodule on his right side. And they said, "We believe it's cancer." And so we realized that we had some choices to make and went to talk to some doctors about it. They said it was stage 1 squamous cell carcinoma, which is a head and neck cancer, and it would be easily treated with chemo and radiation. We would have no issues with stage 1. We caught it early, and we were very happy for that. But by the 1st of March, he did not make it. And so it was a real shock, again, as a caregiver that cared for my husband for quite a while, but that short time with cancer. In that time frame, as I would share our lives, excuse me, on social media, one of my friends from my hometown reached out and said, I have squamous cell carcinoma. I'm in remission. Can I talk to your husband about what he's going through with the feeding tubes and the chemo and the radiation? I said, fabulous. Yes, please help us. And when my husband passed, he and I became closer, and I became his caregiver. Again, Thanksgiving, he started to go downhill. April 1st of 2023, he passed away. And I look back at how a caregiver gives. I never, ever saw myself as a caregiver. I was either a wife of my husband of 30 years or a caregiver to a significant other for a little over a year. I never thought that I needed help, and we'll talk a little bit more about that. Mentally, I would say to people that I was fine, but I would say it with such a high-pitched voice, "I'm fine, everything's fine. I'm going back to work, everything's good. Yes, I've got his meal set up. Yes, he's fine. He only got up twice or woke up twice in the middle of the night, or a feeding tube. Yeah, I've got that. Everything's good." Until I broke my hand. I broke my hand, and I had a boxer's fracture, which the pain went up my arm, which meant I couldn't do anything. I couldn't shift the gear in the car. I couldn't hold something and open a door. I couldn't roll my husband on his side because I didn't have the strength to do it. So what it helped me to realize is that I needed help. I was trying to be this superhero, and trying to pretend like everything was okay. Even in the deaths of two people that were important to me, I still would walk around and run around, excuse me, and say, oh, everything's fine. Life is good. And as I took on this role as president and CEO of Cancer Support Community, I thought I could help people that were on that other side of the hospital bed. It has actually been a blessing to me in understanding the importance of pouring into the caregiver. When a person is diagnosed with cancer, it's their family, it's their circle that is actually diagnosed. And we have different things that we have to deal with and understand. I wanted to be at all of the doctor's appointments. I wanted to understand everything. I'm not a medical doctor, but I wanted to make sure that I understood everything as a caregiver, as a person that cared about the individuals that I loved. So really understanding that word care became very important to me. So important that at Cancer Support Community Indiana, we have provided a caregiver summit that we started in November of last year. And just as an FYI, National Caregiver Month is the month of November because we wanted to make sure that those people who pour into their loved ones who have been given a cancer diagnosis also know that there is help for them. At Cancer Support Community Indiana and at our other network affiliates throughout the United States, we have group sessions, we have online or in-person opportunities for people to talk about what it's like to be a caregiver, to ask lots of questions, to be frustrated, to try to get the answers that you haven't gotten from the doctor, to try to understand what's going on in your head because you want to be that person that's positive and want to be that person that's giving. But at the end of the night, in the middle of the night, you're thinking, I can't help this person with chemotherapy. I can't sit in that chair and take the needle or the pill. I can't feel those feelings that that other person is feeling, but I want to make it go away. And I was that person that wanted to make it go away. And that's what helped me to learn that, I can't be in control of everything. I need the help. I need the help from others. And so that is, again, what's important for us at Cancer Support Community Indiana. We provide free services for anyone who's going through a cancer journey. And those services might include that list that Susan shared earlier of providing group counseling, individual counseling. She mentioned Reiki. We do yoga, we do massage, and those are all certified individuals. So it's not just people that know and like those different things, but they're certified or licensed. So we have a certified licensed oncology massage therapist. All of our people are therapists or social workers, and we want to make sure that we're providing what it is that you're not getting in the doctor's office. And we do that, again, not just in Indiana, but we do that throughout the United States. We have 40 affiliates that are throughout the United States that can provide help for you, that provide help for me as, as the caregiver that I am by nature. I like the other thing that Susan mentioned, the cancer-related PTSD. That cancer-related PTSD doesn't just affect the person with cancer. And I realized that maybe about 9 months ago, that cancer-related post-traumatic stress disorder affected me as the caregiver. That the things that would trigger, I would use the word trigger me, to have memories of my loved ones, whether it was a type of candy bar, or whether it was a smell when I walked into a room, or whether it was a phrase that someone used, or a song that I heard, or a group session that I might be sitting in. It's important to know that we need help too. We're not superheroes. As much as I'd like to think that I'm Wonder Woman, you can see it in the background there. I'm not. I'm not. And neither are you. And that's not to be disrespectful, that's to be real. We want to be the best that we can be for those individuals that are struggling or working through cancer or surviving or thriving, whatever word you'd like to use. we want to be there to help you as an organization and as individuals. So that's what I want to share with you. I refuse to feel overwhelmed anymore because I know it's important to have people that help me, whether it's my loved ones, whether it's people at Cancer Support Community Indiana, whether it's colleagues or friends. We need to know that it's okay to reach out and ask for help. And I'll be answering some questions later. Thank you.
I had my first panic attack at the age of 46. Picture this. The day before, I had awakened from a hysterectomy surgery to discover that, in fact, I had stage 3C endometrial cancer. Now my teenage children were on the way to the hospital to visit me, and I didn't want them to see me so distraught. For weeks after, I woke up in the night to a racing heart and breathlessness. I could not quiet my thoughts or calm my terror. I was in a mental health freefall and began to grasp for anything to hold on to. So I picked up a flyer from my doctor's office for a cancer yoga class. I visited a cancer center behind the hospital and discovered free therapeutic massage. A friend of a friend invited me to meet with a new gynecologic support group, and reluctantly, I went. Meanwhile, to my horror, my tumor grew right back during my initial chemo. The surgeon reopened my still pink incision, and I had my first bowel resection. The next month, my mother died of ovarian cancer. In that dark space, I had a realization. The places where I felt least broken were at yoga, massage, and the support group. That insight, that even though I was very sick, I could still make small choices to support my physical and mental health, tipped me toward advocacy. What is advocacy? It's supporting or recommending a certain course of action. As a survivor, I view advocacy as helping people whose lives are impacted by cancer, including me, and I assume each of you. I was straight up lucky that I didn't die 12 years ago, and I can't take credit for the fact that I'm still here. However, from my earliest days as a patient, advocacy has helped me crawl forward. Advocacy has granted me some small sense of control in a world gone hopelessly wrong. I didn't want cancer to be an unspeakable demon in my house, so I tried to promote a hopeful but realistic narrative. When I was having chemo, my daughter bought red and white red blood cell plush toys. We hung them inside the front door where we could cheer them on every day for their vital work in bringing oxygen and fighting infection in my body. When I was having radiation treatments, I made a colorful paper chain and hung it in the kitchen. Every night at dinner, I would tear a link off the chain. As we watched it grow shorter, we could track my progress toward completion. In these small acts, I advocated for some control over the way cancer affected my household. A neighbor did not want to lose her hair during chemo. Ultimately, she decided to purchase a cold cap to wear during infusions, and as a result, she did not lose her hair. She told me that this was the one thing that really gave her a sense of accomplishment during treatment. That's a kind of advocacy. Similarly, after my chemo ended, I enrolled in a cancer rehab program at the YMCA and spent many hours swimming. The water muted the outside world and freed my mind to wander, processing emotions and memories. Journaling, knitting, gardening, or woodworking would also do. But when I prioritized time for my own reflective or creative practice, I advocated for my mental health. If, like me, treatments left you or your loved one suffering from incontinence, you could suffer in silence, or you could ask about pelvic floor physical therapy. Spoiler alert, it helps a lot. Similarly, sexuality after cancer treatments is different. Let me count the ways: scars, missing organs and hormones and hair, ports and other implanted devices, weight loss or gain, impotence, and reduced sensation or nerve function. You could decide that the intimate part of your life is over, or you could explore new options for lubrication, vibration, medication, and more. This, too, is advocacy. After my recurrence, I was not clear about my prognosis, so I consulted with a specialist. She told me point blank that she did not think my cancer was curable. Shocked, I went back to my oncologist and my surgeon. Separately, I said to each of them, Dr. X thinks my cancer is not curable. Would you agree? Both immediately said yes, not a moment's pause, although they had never volunteered this assessment to me on their own. And so I learned, sometimes the best way to get to the truth is to introduce the bad news yourself and then ask the doctor a yes or no question. The ultimate advocacy is planning for end-of-life care. My cancer group decided to request a tour at our local hospice house. I liked the palliative care doctor and the nurses who promised to handle all hygiene and toileting. I was struck by the quiet, private rooms with views of the woods. I told my husband, when my time comes, please bring me here. Let the nurses give the enemas. I hope you'll sit beside me and hold my hand and brush the hair off my forehead. Caregivers are critical advocates as they help manage paperwork, arrange rides, take notes at appointments, refill prescriptions, and wash the sheets. After my diagnosis, my sister came from California and, with my permission, reorganized my bathroom. Out with the tampons and hairdryer and comb. In with the scarves and hats and prescription bottles. She aligned my physical space with my body's new reality. Then she returned to her own life. Round-the-clock caregiving is something entirely different. It can be exhausting. And as every flight attendant knows, it is important to put on your own oxygen mask before assisting others. My community's hospice house offers respite care, essentially a scheduled short-term stay to allow a caregiver a few days off. To avoid burnout and resentment, caregivers generally need what patients need: counseling, time for reflective or creative practice, exercise, and sleep. Caregivers also need their own support people. When my recurrence required a second surgery, I called my husband's sister, who lives 2,000 miles away, and asked if she could come sit with him in the waiting room so he wouldn't be alone. She came. That was advocacy. To zoom out, in the domains of public policy, education, or research, to advocate is often to write and speak, to donate time and money, to serve on boards, to lobby funding agencies, or to participate in clinical trials. Each of us on this panel have engaged in parts of this work. This, I believe, agency, whether small or large, grants us the dignity of choice and the satisfaction of agency. Even when the options are limited, we retain some ability to define our own boundaries, shape our own narrative, and try to make the path easier for those who follow. In my experience, nothing promotes mental health quite like advocacy. Over the past 12 years, my view of myself as a helpless victim has yielded to a different view of a person who, given the precious opportunity, might make a difference in someone else's life, maybe even today. Thank you. A number of people submitted questions in advance, and we want to make sure that we address as many as we can. Before we dive in, I want to invite you to ask additional questions. You can submit them in the comment box below or in the chat if you're joining us on Facebook. We'll do our best to address as many as we can before we finish. Let's start with this question. I'll just read the questions and invite Susan and Terry to jump in. So a cancer diagnosis is sometimes not a one-time thing and can be a fear as people anticipate relapse or other statistical possibilities. Could you please speak to the ways to handle that environment versus the first-time diagnosis? And as a related question, mental health anxiety at the time of annual follow-up and tests for survivors.
Yeah, I think anxiety is rampant among cancer patients. It's very hard as you approach a blood test or a visual test not to worry that the results are going to mean a recurrence. So that's why people coined the words anxiety. I think you handle that the way you handle the shock of diagnosis, but now you're a veteran and you've got some toolbox tools, you've got some tools at your disposal. But I think it's perfectly normal, and most of the people I know who have cancer do suffer from anxiety about recurrence. I don't see how one can't. So I think the same things that might help you when you were in treatment might help you post-treatment when you're dealing with the anxiety of scans and tests. And those were the ones that I think many of us have used. Massage therapy. For me, it's writing therapy. Writing for me is a major form of therapy. For other people, it could be something like Reiki or swimming, as Dana mentioned. I think you should deal with that the same way you deal with the earlier anxiety, because it's of the same cloth.
I can add.
Go ahead, Tara.
Okay, I can add to the potential first-time diagnosis. Both of my parents had cancer. My father passed away from prostate cancer that spread to his bone and brain. And my mother has had two cancers, breast cancer and thyroid cancer. She is 83 and still living. But every time I go for a colonoscopy, which I had to start doing early, as well as the mammogram, which I had to start doing early, that anxiety comes because the possibility of me having cancer, and I also have not birthed any children, which makes my possibility even higher. So every time I go for a test, the possibility of someone saying that you have cancer comes. But I think that for me, I know that research and other things have developed so much more than 25 years ago when my father was diagnosed or when my mother was first diagnosed. So my response now, if that ever happens, is, okay, so what are we going to do about it? That's the way my mother that's the way that she goes toward it when she goes to her appointments every 6 months. If it's going to happen, she says, I'm just going to say, so what are we going to do about it? Not what am I going to do about it? What are we going to do about it? Because it's a team approach with the doctors, with the caregivers, and with family.
Let's go on to another question. Do you have suggestions for how to address family members, especially in circumstances where the family member is not supportive? And as a kind of a follow-up, how can friends and family be supportive of mental health and cancer patients?
Wow, I think that there's such a variety of answers. Many times when something unusual or different than the norm happens in a family, and doesn't necessarily have to be cancer, it could be anything that might happen, traumatic or dramatic in a family, how does that person typically deal with whatever that is? Or how do you typically deal with whatever that is? And then how does it affect the other person by the way that you respond to different things? So we want to make sure that whenever there are family and friends that are supportive and or not supportive, how do they typically respond? Do they walk away? They need time away? Do they get angry and short-tempered? Do they cry? Uh, do they need to be held? And so those are the same things that you want to try to do when a cancer diagnosis comes. So again, it really depends on how the person typically responds, but it might be a different response. So again, I don't think there's a 1, 2, 3 recipe, if you will, for how to be supportive, but it's to be there until they need space and give a person space. And when they need you there, be there. Sometimes it's just to sit. I've had people that just came to sit with me, came to sit with my husband. They may have come to play chess. They may have come to just give me a respite. So it depends. And as the cancer patient, you have to learn how to ask because people can't support you unless they know what it is you need. And I was that person that didn't need anything. Oh, I don't need it. I can do everything. Not true. So you know what you need, and it's important early on to get to that point to say what it is that you need in order to get the help.
I'd also like to put a word in for cancer support groups, patient-oriented, patient-led
Oh, yes.
support groups. I mean, I think in my own life, I could not have gone through much of what I went through without the help of the other people in my support group. And some support groups are organ specific, in other words,
Yes.
my support group is composed of women with gynecological cancers. Some have endometrial, some have ovarian, but they're all gynecological cancers. And so we have similar protocols of our treatments. And people read different things, they have lots of different perspectives, and some people are very proactive about their disease. Some people are a little bit more laid back, but the diversity in the group in that way is extremely helpful. And those people also are very often have very specific suggestions about diet or about nutrition or about exercise. That are not exactly medical, but they are surround the medical issues, and that can be very helpful.
Let's take on a different question. What tips can you provide to encourage someone to access mental health services? And how should we suggest that others seek mental health services?
One of the things that we've learned at Cancer Support Community Indiana is that we like to have opportunities for community events. We call them community-related events. So we may have a survivorship summit or a fall festival or activities where cancer patients, people that may have not been to our place before, can come and just enjoy themselves. They can create greeting cards. They can take a yoga class. They can come and listen to some music. They can put together an art project. So we want to get people here so that they can see the opportunities that we have, the programming that we have. And just to remind you, Cancer Support Community Indiana is one of several network partners. So if you were to go to cancersupportcommunity.org, it will have a map of the United States, and you can click on the state that you're in if you're not in the state of Indiana. If you are in the state of Indiana, then it's cancersupportindy.org. And you can go right there and learn about some of the programming that we have. And so sometimes it's just to get in the door, to come somewhere, kind of like Susan said with our support groups, and just be around people that might give you a suggestion, people that you walk in the door and you realize that someone else is there that you know, or you feel really good about being here at an event where we may have a cooking for wellness, which we just had last night. And we had 10 people here learning about a healthy meal. It was online, so people are online learning it. People get to eat the meal if they're here on site. So they eat the meal, and while they're eating the meal, they're interacting with each other. And so different types of conversations might come up. And so people will know that, oh, there's someone that's like me here. Or there's a group that I can go to that's specific to the type of cancer that I have. Or, I really need for somebody just to talk to me. I need help individually. Or, I'd like to have a massage, and we offer those free of charge too. I have this pain, or my lymph nodes aren't draining like they should, and those people can help you here. So that would be my response.
I think I think all of us would agree that we have to continue to work in our culture at large, against the stigmatization of mental illness. I mean, and seek to make it clear to people that it's not a failing to need mental health help. That's something that's a larger, societal concern.
In addition, I think the best way to encourage someone else to do something is often to do it yourself first. None of my children wanted to have any kind of therapeutic support after my diagnosis, so I finally went to get therapeutic support and said, "Here's what I learned at therapy today." And they still didn't want to, but I think by example.
Yeah.
Let's take on a different question. How should you help yourself when you feel depressed from the loss of a loved one who was young in age?
That's a very difficult question. And that requires some real thinking, and it's heartbreaking to think about. There are some sorrows that come that are just one has to just deal with them, and they're very hard, very hard.
I would
I think always, for me, it's talk therapy. It's the old talk therapy. I mean, I think, oh dear. Sorry.
You're fine.
I think talk therapy is a big help, by which I just mean conversation. I don't mean you need to go to a therapist, or a grievance counselor, although those people can be very helpful. But I really believe that being able to talk to friends and family and other people who have experienced loss is a great help. I think poetry and music can be an enormous help. And I think knowing that takes time is important, that the grieving process takes time.
I'm sure you're familiar with the 5 stages of grief. When I was in treatment, I read a book called The 5,000 Stages of Grief, which felt much more accurate to me. It's a long and complex process, but in my experience, repetitive activities, walking frequently with friends, being outdoors, things that make you feel in touch with being alive can at least help. Here's another question. How do I deal best with my child's ongoing brain cancer when she's not dying from it, but it still disrupts her life regularly?
Another very, very difficult question, and one that cannot be answered off the top of the head, one's head. It's a very difficult question. When cancer treatment is when cancer is chronic, it poses a whole new set of problems for caregivers and patients, no matter what their age. And with a child, that adds enormous complications.
It's important in life to, whether there's a diagnosis or not, to make memories. Very, very important to find whatever it is that you can do, whether it's in the house or outside of the house, but connecting with your loved one, making those memories is very important. So don't forget that it's important to find whatever that new normal is, and find a way to get the joy out of that new normal.
I would also be tempted to set up some kind of regular infrastructure. The question really is focusing on the parent here. And so for that parent, can you have regular therapy? Can you have a regular massage? Can you have regular friends who are doing things for you? Can you have regular days or times when you get to be alone or do the things that you need? Can you get away, once a quarter overnight? Can you structure into your chronic life things that will give you respite from the emotional and physical demands of caregiving?
The first thing that I would suggest, which is something that I didn't do, is breathe. I became a very shallow breather because when I would take a deeper breath, the emotions would come out. And that's what I needed to happen. Whether it was a hearty laugh or whether it was crying to the point of making loud sobbing sounds, we have to make sure that we're taking deep breaths. That's the first thing. And there was a question here, Dana, in the chat, suggestions on how to make the most of the day. 1 minute at a time. I mean, just being able to put, whether it's a caregiver or the diagnosis, sometimes just getting out of bed is all you can do today. Or watching something on television that will just make you feel a little bit better, or eating that comfort food, or calling someone. Don't wait for them to call you. Call them and say, I was just thinking about you. Or going to that special place that you go to where you feel better. Take a deep breath. In fact, why don't you just do that right now? Just take a deep breath. Ooh. Oh, I think I needed that.
I did,
To
Mary.
follow
I did too.
To follow up on that question, the question says, since my diagnosis, I felt pressure to suck the marrow out of life and not let precious days slip by. In the haze of being busy, any suggestions to how I could make the most of the day would be appreciated. I think that a diagnosis, which is a trauma, is also a sort of get out of jail free card that enables you to look at what you're busy with and say, what can go? You have absolute permission to opt out of anything that you don't have to do to stay alive. You know, anything that is optional or voluntary, any people in your life that you don't really want to have to interact with, you have kind of a special card now, and you can just be too busy or be resting or whatever. So fill your days with the things that are meaningful to you, that are important to you, that speak to your values. We have one last question, and this one says, what spiritual beliefs, practices, and characteristics or perspectives are helpful or perhaps unhelpful to the person and their loved ones traversing the experience of cancer and cancer treatments?
As a spiritual person, I rely on my relationship with God to get me through everything. One of the things that I do often, whether I'm in my office, in my car, at home, I like solo piano music and I love hymns. And so I tend to play solo piano music hymns to calm my spirit, to get me focused, to get me going through the day. I also have a ringtone that comes on when I wake up in the morning. That's actually a spiritual song that gets me going, that reminds me that, God has given me grace and another day to get through, and I'm going to get going.
I do begin every day with some yoga and meditative time and gratitude, and I say out loud the things that are most meaningful and most precious to me as a way to orient myself to a new day, and I find that deeply grounding.
Just one other thing, my mother, on her mirror in her bathroom, she has little pieces of paper of the things that she's grateful for, and she readjusts them based on the people or the things that she wants to remind herself of so that she sees it every time she goes into the bathroom. Yeah.
Well, thank you so much for joining us at this month's Simon Says. You can find a recording of today's session and information about upcoming session at cancer.iu.edu/Simon Says. We hope you'll join Simon Says next month as the IU Health Complete Life Center highlights additional therapies to explore during cancer treatment, from massage therapy to art therapy and everything in between. Thanks for joining us. Have a great day.